Welcome back to Pedi Derm Cases and Quizzes. I'm glad you're here. I just got back from Tanzania, where albinism is very prevalent, and that is what we're going to be talking about today. So very timely. Also, what makes it timely is June is Albinism Awareness Month, and June 13th is Albinism Awareness Day. So excited to be talking about this whole group of conditions that are so important, not just for knowing about them, but also for the boards, because the people that write the boards love questions about albinism. So let's get started. I'm Dr. Alanna Bree. I am the Director of Pediatric Dermatology Collaboration at Sagis. I also am a speaker and advisor for CeraVe, and also the founder and director of Made a Masterpiece, the only 501c3 in the US that supports the social, emotional, and spiritual aspects of kids living with visible differences. So let's get started. So this is a quiz. Like I said, lots of board pearls in this one slide here. So we are going to be looking at non-syndromic oculocutaneous albinism. As you guys know, there's 7 different types, and they are all caused by a different causative gene. So again, very high yield information here. And I'm going to let you go ahead and take this little quiz, pause your video here, and see which type of oculocutaneous albinism matches with the causative gene. Put those together, and then we'll be back to go over the answers. So here are the correct answers. Hopefully you got many of them right. We're going to be going over these each individually. So let's start with the non-syndromic oculocutaneous albinism types. Again, 7 types. Again, very high yield slide, so you may need to pause it and kind of digest this or come circle back to it. But all of the non-syndromic types of oculocutaneous albinism, OCA, are inherited as autosomal recessive pattern, but they all have different gene mutations. Now, oculocutaneous albinism 1, 2, 3, and 4 are a little bit more common, still very rare, genodermatosis, but most common. And then the types 5, 6, and 7 have really only been reported in one family or a handful of families. So those we don't have to know as much, but the OCA 1 through 4, we're going to talk a little bit about. So OCA 1, its prevalence is 1 in 40,000 worldwide, most common in America and China. That's where 70% of cases are found. And then there's a type A and a type B. So they are slightly different. It depends on the amount of albinism. So in type A, we have complete absence of the melanin, and that's why they get really, really white skin and white hair. That's why their eyes are pink or red, because they also don't have pigment in their iris or in their retina. And then type B, the yellow OCA, and again type 1, they do have some residual tyrosinase function, so that gives them, lighter pigmentation from, their family members, but not completely white. So again, OCA 1, and again, most common in America and China. Now, OCA 2, that's more common in Africa. And that's where I just got back from again. Love my people there. And the reason that that's happened is there's kind of a founder effect. So in the US, it's 1 person in 39,000 in America, but in sub-Saharan Africa, it's 1 in 3,900. So again, very much more prevalent because of the founder effect. There is the classic OCA 2, which again, this is the most common type in the world, is classic OCA 2, tends to be more of a creamy white skin. And there is some pigment to the hair, but you can also have brown and red versions of OCA 2. And again, most common type of albinism in the world. Next is OCA 3. Again, not as much prevalence. Again, more common in Africa, but it has been reported in some other countries. And really, this is the type that they call rufous or brown OCA. So again, that is sometimes what you hear OCA 3 referred to. Then OCA 4, this is the type that's most common in Japan, and it has more predominance of the pheomelanin, so that's why it looks a lot more similar to classic OCA 2. And the hair might be a little bit lighter, more silvery white to blonde, but still suffer from, the visual acuity issues that all of the oculocutaneous albinism types have. Moving on to the syndromic versions of albinism. So again, there are many syndromes out there where albinism is just a portion of that. So we have several of these. There are 5 different ones. And again, they all have a different gene mutation. So if you think you know the answers, go ahead and put your answers in the comments right now. I would encourage you to be brave and just put those answers in the comments right now. And we're going to circle back and see if you're right in just a minute. All right, so here are our correct answers. So again, if you put those in the comments, yay for you, so proud. And again, this was a tricky one. Again, answers could be used more than once, and there are multiple answers for one of these. So we know that Hermansky-Pudlak syndrome, there are 10 different types. So there were 2 answers, B and E, and then Shidiaki-Higashi, that has just one answer. As you know, it is list. And then Angelman, Prader-Willi, they're both due to partial deletions of chromosome 15q. And then oculoalbinism, which doesn't have the cutaneous features, sometimes you can have lighter skin, also is due to one single gene mutation. So going through these each individually, Hermansky-Pudlak syndrome, it is a very rare condition. The prevalence is 1 in 500,000 worldwide, more common in Puerto Rico, significantly more common because of that founder effect again. So 1 in 1,800, it is autosomal recessive. There have been 10 different genotypes identified with HPS syndrome, and we do know that the subjects will have oculocutaneous albinism. They're going to get this fat-like protein that also builds up and accumulates in their tissues, especially the kidneys and lungs, and that leads to this bleeding diathesis just due to the lack of the dense platelet granules, and again, that leads to abnormal aggregation. So again, some forms, Hermansky-Pudlak syndrome 2 and 10, have an immunodeficiency component because of the neutropenia, and they get hemophagocytic syndrome. And then we know the most severe types, HPS1 and HPS4, those are both due to the block3 protein mutation, and those lead to pulmonary fibrosis and granulomatous colitis. So again, Hermansky-Pudlak, many different types, many different gene associations with those. Now, Shidiaki-Higashi, CHS, that's very rare, less than 500 cases published in the literature. It is also autosomal recessive, caused by the LIS gene. And again, these lead to those giant cytoplasmic granules in the lysosomes. So you have diminished chemotaxis in your leukocytes and in your platelets, and they will present with a partial oculocutaneous albinism where they have hypopigmented skin, this gray or silvery sheen to their hair, with the associated nystagmus, foveal hypoplasia, and photophobia that's common in OCA. And then all subjects do exhibit this increased risk and susceptibility to pyogenic infections because of the neutropenia. They can also get peripheral neuropathy and then a mild coagulopathy. So Angelman syndrome, again, this is a very interesting condition in the fact that only 1% will present with OCA2-like presentation. So again, very rare finding in Angelman syndrome, and it depends on which portion of chromosome 15q is involved. As far as the deletion, and again, this is spontaneous. It's not autosomal dominant recessive X-linked. Again, these are spontaneous mutations that happen where a portion of the maternal chromosome is deleted. And that leads to, again, in 1%, hypopigmented skin and hair relative to family members and the similar ocular features that you have with OCA. Other findings in Angelman syndrome are characteristic facies, short stature, intellectual inability with a kind of somewhat spastic gait and stiff arm movements, and then kind of the classic association is the spontaneous outbursts of laughter that children with or individuals with Angelman syndrome can have. Prader-Willi, also different, again, spontaneous deletion, and this usually involves deletion of the parental chromosome 15q or a parental dysomia of chromosome 15. So again, a slightly different inheritance pattern of Prader-Willi, but again, 1% of people with Prader-Willi syndrome can have this gene deletion that gives an OCA2-like presentation. They have the hypopigmented skin, as well as poor muscle tone, short stature, small hands and feet, and then they get this hyperphagia that leads to obesity and type 2 diabetes, which is kind of the classic what people know about Prader-Willi syndrome. Moving on, ocular albinism. So again, this prevalence is actually more prevalent than you might think, 1 in 50,000. It is X-linked, and it's due to this product, the G protein coupled receptor. There's a mutation in that, and it leads to hypopigmentation in the eyes, and that leads to then the ocular findings. And the females, because of lionization and X inactivation, rarely have the nystagmus or the low vision. And again, these patients that are affected typically don't have many cutaneous findings. They might have a bit lighter skin than those in their family. As we mentioned, I just got back from Africa, one of my favorite places in the entire world. And it is because I just have a heart for these kiddos with albinism. So it is hard to stand out and be different in the world. We know that, and that's why Made a Masterpiece exists, because it is good when we know we're not alone, and especially kids that wear their disease. But children in Africa that have albinism, people in Africa that have albinism, they face some very significant and unique challenges that I think are important to bring awareness to. So there's widespread social discrimination. Again, we know it's an autosomal recessive condition. So both parents are Black, and then they have a white baby, which we know is what happens with recessive conditions. The parents don't express the genes, but they are seen a 1 in 4 chance in a child that they produce. So again, powerful myths about that. Sadly, they also don't know about sun protection, very limited ways for them to get sunscreen in country. And in the US, Americans with albinism, they live a normal life expectancy. Yes, they have to sun protect, but when they get the skin cancers, if they haven't sun protected appropriately, they can be easily treated. In Tanzania, there's only one clinic basically in all of the country where they're well trained to take care of the skin cancers. So they present with very advanced stages of basal cells and squamous cells. So only 10% will live to 30, and only 2% live past the age of 40 because they die of these skin cancers that are, again, otherwise treatable. The other issue is their low vision isn't quite understood. They don't have as many aids that help them with their low vision because, again, they don't get that pigment in their eyes when it develops. So again, multiple things in their eyes affect their vision and leads to this low vision. The other thing is they are sadly hunted for their body parts. Their long bones are thought to have special powers, so many witch doctors make potions of their bones. So again, some really horrific things. When there is lack of education, lack of understanding, we can really come in and fill that gap as dermatologists, and it's a real blessing to be able to do so. And I will tell you that I started, my very first visit was in 2014. I've been back 3 different times, and I have seen the progress, and I'm so thankful for that. And again, it's if we can each do our little part, it really moves the needle in big ways. Many kids end up in orphanages because they are more protected there. But again, the social stigma leads for a lot of children to end up there. This, my friend, he had been left there as a small child and had never seen his family again, and was just getting ready to get out. So again, the unique challenges they face make these kids pretty heroic in my mind. And again, we do clinics, we do skin checks on these kiddos to try and identify skin cancers early and remove those. Here, I had a small team with a derm nurse, me, another pediatric dermatologist, and a neonatal nurse. And we went to 3 different orphanages this week. It was back in 2019, and we removed 100 skin cancers in kiddos in just 3 days with albinism. So again, we can really move the needle for these kids. And most recently, I got to collaborate with Shade School. They are near and dear to me, kind of in central Tanzania, Shinyanga area. And here is John. He is the country director. He's an amazing singer. He has a twin brother with albinism as well. And then Claire, the US director, who's also the founder. And again, just Shade School is doing amazing work, and I'm glad to be partnered with them. And you can see here, they're really making a difference. They have an inclusive school, so you can see the kiddos with albinism have the blue hats because they're sun protecting. And just a beautiful campus here that not only is educating the children in the area, but they have a garden that brings fresh fruit to the area. They do micro loans for the community. They have a well that they've drilled. They have chickens as well. And again, just such a great support for the community. Not only are they educating, but they're also dispelling myths about albinism. And there really is hope for people with albinism in Africa now. This is my friend Panina. She is a recipient of one of those micro grants from Shade School. She works in her own pharmacy there. And again, just such incredible heroes just for what they're doing. The people at Shade, but also the people with albinism that live so bravely with it in these countries and are making a difference. So thankful for all the support for people with albinism in Tanzania and in Africa. And you can see here, there's lots of people that are now doing the work to make it better. And again, I would encourage you that if you have a heart for kids with albinism, to get involved with one of these groups or to reach out to me, because I would love to go to the field with you or have you support alongside, just because, again, we can really move the needle when we come together to do so. Oculocutaneous albinism does happen in the US. Again, we know OCA1 is the most common type in the US, and we have great support organizations. NOAA has done an amazing job for many, many years. The National Organization for Albinism and Hypopigmentation, again, NOAA, doing great work. And then my dear friend, Raisa Levy, who has started Maasai World, and they're also fighting stigma for people living with albinism and also vitiligo. I hope these slides are impactful. I hope you've liked the Pedi Derm quizzes and cases that we went over today, and I look forward to seeing you next month when we're gonna be covering some more good stuff. And this time we'll be coming to you from Kenya.